Welcome all. Question for the day. Why oximes are not used in carbamate poisoning? For that, you need to know oximes are used in which poisoning. It is used in the treatment of OP poisoning. That is, it is used as an antidote in organophosphorus poisoning. So basically, you need to know this is acetylcholinesterase enzyme. Okay, so there are two sites are there. One is anionic site and another one is esteric site. So usually this acetylcholine comes and binds in the esteric site and it gets hydrolyzed. So this is what is happening normally. But in case of OP poisoning, what happens is all OP compounds goes and binds with the esteric site and it prevents the binding of acetylcholine to esteric site and prevents its hydrolysis. So this is the problem in OP poisoning. So from this diagram you can see which site is empty in acetylcholinesterase enzyme, anionic site. So when you give oximes now, oximes will comes and bind in the anionic site of the enzyme. So oximes will be there in the anionic site and OP compounds are already present in the esteric site. So this organophosphorus compounds, that is the phosphorus group of OP compounds, forms a bond with the oximes and it gets hydrolyzed. So once it gets hydrolyzed, what happens? Again, this esteric site will be empty. So acetylcholine can again come and bind to esteric site and it can undergo hydrolysis. So this is how oximes will reactivate the acetylcholinesterase enzyme. So that's why oximes can be used as an antidote in organophosphorus poisoning. But the important point which you should remember is oximes should be given within 24 hours of poisoning. If not, the phosphorylated enzyme can undergo aging which will be resistant for reactivation. That's why oximes needs to be administered as early as possible in case of OP poisoning. But the question here is why oximes are not used in carbamate poisoning. Again, this is the acetylcholinesterase enzyme. Two sites are the anionic and esteric site. In case of carbamate poisoning, what happens? This carbamate comes and binds in both anionic site as well as in the esteric site. So if you give oximes, oxime does not have any place to bind in the anionic site to produce its action. So that is the important reason why oximes are not given in carbamate poisoning. First point. Second point is even oximes are contraindicated in carbamate poisoning. Why? Because oximes itself has weak anticholinesterase property which will worsen the patient's condition further. So one thing is oxime does not have any place to bind at the anionic site as it is already occupied by carbamates. Second point is oximes itself has weak anticholinesterase activity which will worsen the patient's condition further in carbamate poisoning. So these are the two reasons why oximes are not used in case of carbamate poisoning. Thank you.